For diagnosing melanoma, I know the way that I was diagnosed was through a biopsy. They just did a what's it called? Like they either do a Mohs procedure or like a scrape biopsy. That's not the word. I can't think of the name. I just want to call it like a scoop biopsy, but I know it's not the word. I've had plenty of them. They just take off the first chunk of your skin and they send it in. So for me, they cut out they biopsied the area, sent it in, and then I don't even remember if they told me it was melanoma at that point, but I knew it was skin cancer. And so they scheduled the surgery. And so from there, they took a big chunk out of my arm and they removed some of my lymph nodes to see with that sentinel node biopsy to see if it had traveled. And it had. And because I guess my margins were clear on my arm where they removed a chunk of it and they went down to like the bone, sewed it back, and those margins were clear, but it had gone to my lymph nodes. So that's what staged me at 3. And then I also know that for diagnosing and everything, scans, because melanoma can start without there being any mole, any site of origination. And you don't know you have it until there's side effects, basically. One of my dear friends, she had no site of origination and she didn't know that anything was wrong until I think she like passed out or like collapsed one day, was kind of dizzy. She went to the hospital and they ended up doing a brain MRI and she had mets all in her brain and lungs and she died 6 months later. But and I think that's the scariest part to me about melanoma is there's nothing to indicate that anything's wrong. There's no lump, no mole, no weird freckle, nothing that looks abnormal from the outside, yet it starts somewhere in your body and is just growing and metastasizing. So I know that for me to keep up I think I've graduated to every 6 months. I get I get CT scans of my thoracic cavity and my abdomen and chest, because I know that if it were to come back, that's the first place they would look. I think like the kidneys and lungs and stuff are the first places they would check. And then I know last year I also had a brain MRI just to make sure, because I was having some neurological problems that were probably a result of the interferon, the treatment. But I think they want to make sure that they were met. So I know between scans, CT scans, PET scans, and MRIs, and then biopsies, and also a really big part of melanoma is seeing your dermatologist regularly for skin checks, and just being vigilant yourself for looking for anything that's changed, and just like really knowing your skin and knowing your body and just keeping aware of any changes, because that's like the number one indicator. So